My name's Rob Shoplock. I'm the Vice President of the Professional Firefighters of Idaho, and I am a Battalion Chief with the Eagle Fire Department. I've been in emergency services for the last 23 years. The last 12 years, I've spent lobbying for the Professional Firefighters of Idaho and have had the opportunity to work with a lot of first responders around the state. And over the last 5 years, we started really noticing a trend where our first responders were opening up a little bit more to one another, talking about stuff that maybe when I first started that wasn't being discussed in the firehouse. You know, you kind of kept your feelings to yourself and you didn't share them. And as we started having conferences, learning about how to help one another, and it really started for us, at least in the fire service, where we started a program called Saving Our Own, and that was fireground stuff, and that was how to rescue one another into a burning building. And people started going, you know, we've got a lot of issues at the firehouses. We need to start taking that Saving Our Own and bringing that back and to the mental awareness of one another. So a few years ago, we ran a conference and just threw it out there, like how do people deal with the issues they see, the traumas, and you know, you had the group that was, oh, you know, that's just what we get paid to do. And then there was quite a few people that started calling, emailing me saying, you know, I've been having trouble sleeping. I've been turning to alcohol quite a bit. I'm on antidepressants, and we're fortunate enough in the Valley to all see a similar physician. And I think as we started talking with that physician, a lot of our mental stress and injuries started manifesting more into these physical ways, where whether it was our blood pressure, and again, like I talked about, whether it was our diets, whether it was hiding our issues with alcohol. And that led to, okay, let's collaborate with first responders and find out how we can take care of our members. And the great thing is we have so many members, whether it's in law enforcement, paramedics, dispatchers, firefighters, who have spent time in the military and are very familiar with post-traumatic stress injuries. And what we found was in Idaho, unless you had a physical manifestation from an injury, you could not make a workers' comp claim. So if law enforcement went into a school shooting and, you know, God forbid, saw multiple deaths of children or a very traumatic event like that, and they all of a sudden started having maybe a mental breakdown, were not able to come to work, a change in habit, that wasn't something that was covered under work comp. And we really felt like as firefighters, as first responders, it's our job to take care of one another. And then the community started rallying around the support of, let's take care of our first responders and make sure that they do have their full careers. The rates of suicide in the last decade have gone through the roof on first responders. And when we have more law enforcement, police officers, firefighters, dispatchers that are dying by suicide, we certainly have an issue. So that's where we started drafting legislation. And you know, to this point, it's making sure the information is out there and that all our first responders know that it's there, how to access it, and what it actually means. So Idaho, you know, is an interesting state. Our legislature is made up of 105 legislators, and then we have our lieutenant governor and our governor. And for us, it was when you bring a bill to the legislature, they really want collaboration. And for us, that's bipartisan support. So law enforcement and our dispatchers, and with help of some of the organizations around the Valley, we were able to lobby our legislators and get a large bipartisan group together to put some legislation in place that would cover post-traumatic stress injuries under workers' compensation. And what that looks like is a couple different things. It could mean that I am starting to have some physical manifestations from some psychological injuries, whether my sleep pattern's off. Again, I talked about alcohol, substance abuse, feelings of depression, feelings of suicides, those sort of things. I can go see my physician, and then they can recommend me to a psychologist or a psychiatrist or somebody who's trained in post-traumatic stress injuries. The really big piece of this is trying to work with the cities and counties and fire districts and ambulance districts. And we all know as first responders, our employers have to stay profitable. So we really wanted to work hard on putting a bill together that had very strong sideboards to avoid quote unquote abuse of the system. And not that we felt like people were going to abuse the system, but we wanted to make sure that the injuries that were occurring truly did come from the job. So writing the legislation, we did it in a 1-year time period. Myself, it was the FOP, again, some of the outside agencies. And what we did was we drafted legislation where you had to be diagnosed with post-traumatic stress injury or post-traumatic stress disorder by somebody who's licensed, who's a psychologist, a psychiatrist, a counselor who specializes in PTSI. So not only that is that there's a diagnosis, but it has to be clear and convincing that that took place on the job. That could mean something as seeing a mass casualty incident, multiple pediatric fatalities. It could mean the death of a coworker. So they use this manual called the DSM-5, and it's very important for our responders to know that when they talk to their psychologists or their psychiatrists, that if there's going to be a diagnosis, the DSM-5 is the go-to manual to make sure that they fall under those parameters. With that, being that the legislation went into effect almost 2 years ago, the injuries had to take place after July 1st, 2019. So even though we've had an accumulation over 20 years, there must be a triggered event after that July 1st, 2019 for the post-traumatic stress injury to go through the work comp system, meaning retirees couldn't come back in and make claims and things of that nature. So again, not trying to overburden the system, but also we are limited in this state with how many counselors and psychiatrists that we do have that are trained in post-traumatic stress injuries. So I do want to just hit the clear and convincing, we ran a cancer legislation a few years ago, and it was presumed, meaning if you were a firefighter and you were on the job for a certain time, you got certain cancer, it's presumed it was from the job as long as you met X, Y, and Z. Beyond a reasonable doubt is where our law enforcement officers are going to know this really well, and that's when you charge somebody with first-degree murder. That's the highest amount of evidence to convict that person. So we went with the clear and convincing, and that's around that 60% range, 66%, that injury was clear and convincing, on the job related. Our experts that we interviewed and worked with, not just in the state of Idaho, but states around us, were very adamant that PTSI is very treatable. And the one thing that we, as the organizations, the Fraternal Order of Police, the sheriffs, the police chiefs, the fire chiefs, dispatchers, and our cooperators, is we want our personnel back on the job. And really the military found that that was one of the best things to do, was once they pulled soldiers off the battlefield for post-traumatic stress, was finding jobs for them to do while getting treatment. As of January of this year, talking to the Work Comp Advisory Board, the Industrial Commission, all but 2 of our claims had gone through. And that's because our members are filling out the paperwork correctly. They are going and getting treatment. They're going to the physician, and they're opening up, and they're being able to have that dialogue. And also they're keeping journals of when these events take place. So if there's a triggered event, that's very important to work comp. And work comp is very specific that you have 30 days to file a claim without having any issues. So it's very important, if you start having any sort of psychological response to a call or changes in yourself, it is very important to see that physician, get a recommendation to the psychologist or the psychiatrist, and make sure that we are going through the workers' compensation system. When we start on talking about the list of people who we want to thank for putting this legislation in place, it starts at the top with our governor. Brad Little, from day one, before he even took over as governor, he came and stood by and he told us as firefighters and police officers and first responders, I support you. When you have the governor's support, it goes a long way as we're able to go and start talking to legislators, because he understands how important our first responders are to the state and the communities. So when we talk about bipartisan legislation, 105 legislators, we were able to get just an overwhelming amount of support of senators and members of the House to sign off and put their name as sponsors and co-sponsors of the bill. And for every single one of those, when I look at Senator Chuck Winder on the Senate side, who was a huge supporter in the beginning of this, and then we hop over to the House and you have House Minority Leader Matt Erpelding, Representative James Holtzclaw, who chaired the committee, Senator Jim Patrick of Commerce and Human Resource, and I could go through and I could give you 97 other names of legislators, because when this legislation did pass, we had very few legislators vote against it. One of the biggest reasons we got the big support we did is we put a sunset clause on it. And as I mentioned before, it is very important for us to make sure that our organizations stay profitable. And when I mean profitable, I mean that we are not bankrupting the system with taking people offline and causing more overtime, that we're not taking people off work, hoping they get better at home. But through the work comp system, there is progress reports, there is accountability, there is making sure that people come back and they're on light duty. So work comp has a 3-year average to find out what specific legislation will do. The best example I can give is the department I work for is a pretty small fire department. We have roughly 52 employees. Every 3rd year, we get reevaluated for our work comp, and that has, how many shoulders, how many back, how many knee injuries, how many mental injuries, and what does that cost the department. So the reason for the sunset is we want to run the numbers statewide and see where we're at with claims. And hopefully, like when we ran the cancer bill, just the awareness of what that bill entailed, the amount of firefighters that stopped using tobacco, that started getting annual physicals, that lowered their blood pressure, that had got themselves, who were predisposed to diabetes, changed their diet. We're expecting the same sort of response to this post-traumatic stress injury. And what I'm saying is more and more people, myself included, are going and we're seeing counselors. So I can even speak to this on a personal level, having been in the fire service for 23 years and starting to where it was keep your emotions to yourself, don't talk about them, to we're going to sit at the kitchen table and see how everybody feels. I think I spent 2 years getting a lot of phone calls about people dealing with post-traumatic stress injuries, and I started internalizing those phone calls, whether it was law enforcement, dispatchers, firefighters telling me about what their struggles were. The common theme was a lot of people are dealing with their struggles through alcohol abuse, and I can say I found myself masking my own issues, and I'm not afraid to admit it here. Obviously, it's not something that I'm proud of, but I think getting a good physician to help me put a plan together, getting a good psychologist to help work through is going to not only prolong my career as a firefighter, it's made a world of difference with my wife and children. It's made me a better person. I think once we can admit it, and maybe we don't have to do it at the dinner table, but I encourage you as you go in and you get your physical, if something's off, we all know when we're off, it's okay to have that discussion. It's private. And we want healthy and we want people to have longevity in their careers. And we all want to be able to, once we're done, not look back and say it was a great career, but really enjoy our retirements. And I think not only do we want to be physically in good shape, we need to make sure that we are mentally fit when we enter into retirement. So as first responders, we're so used to responding for calls for help. And this is the time where your Idaho first responders, we're coming to you in the public, and we're going to be asking for your support. And that means logging on to the link, being part of the email list, following social media, and hearing the calls when we do go back to session and we go to remove the sunset, because we do need to keep this healthy workforce going. This trend that we've started 2 years ago, where mental health is being addressed, injuries are being healed. We have members that are going and they're getting inpatient counseling. We have first responders that are seeing counselors. We have marriages that are being saved. We are building a stronger workforce mentally, which then obviously leads to the better customer service in the long run. So from the bottom of my heart and the rest of the responders that I have the privilege to work with in the state of Idaho, when the message comes out, the call to action comes, we would ask you to please contact your legislator and ask them to repeal the sunset off of this bill. It would make a huge impact on the state, and we certainly appreciate your support. To all my friends out there in the first responder world, police, fire, EMS, and dispatchers, I want you to know, not only for yourselves, our retirees, and our family members, so our husbands and wives of first responders, you're going to hear about some resources that are available. So this is so important that we continue to focus on the mental health and knowing what resources are out there. The worst part of this process is 2 years into it when I hear first responders say, I didn't know that there was anything out there for us. And it breaks my heart because I know the struggles and I've heard the stories and I've heard from the spouses. And I can't tell you, there's not a month that goes by where I don't hear from a first responder or a first responder spouse or child about what their husband, their wife, their dad is going through, and they're looking for help. And there's some amazing resources that are going to be part of this video, and I would just encourage everyone to share on your social media, whether it's through Facebook, Instagram, Twitter, make your own TikTok. I don't know, I'm getting kind of old. I don't know if there's anything else that's cool out there, but those are the ones that I know of. So we certainly want to get the word and the message out.